Okay, so rectus femoris, AIIS. So as you're going, if you're in that inguinal ligament area, kind of at right as you get that division between the abdomen and the thigh, you can go pretty much medially laterally and feel the 3 hip flexor tendons. The biggest one is the iliopsoas, and then the middle one is the AIIS. Off the AIIS is the rectus femoris, and then the one off the more lateral one is the sartorius. And the sartorius one is going to go ASIS, and it comes all the way down here and wraps around and attaches right here on the anterior medial tibial condyle with the gracilis and the semitendinosus as part of the Pezzian serine. Remember we talked about that with the gracilis? Part 2 of the Pezzian serine is the sartorius. So part 1 is the gracilis. Part 2 is the sartorius. Part 3 will be one of your hamstrings, the semitendinosus. So you have the sartorius coming this way, you have the gracilis coming straight down, and then you're going to have the semitendinosus coming this way. And they're all going to insert right here in that goose foot Pezzian serine insertion. So sartorius is palpable the entire muscle. So you can catch it right at the ASIS, and then you can come down. She's got nice baggy shorts, so it makes it really easy. And it's not very big, so you kind of got to work through making sure you're not on the quads. But it's relatively superficial. And the action of sartorius, besides being a hip flexor, it is also an abductor and external rotator. But again, action-wise, sitting is easier. You can do it supine. You're just going to have them take their foot and cross it over their opposite knee. The talar muscle.
Can you do that while they're laying down? When
you can absolutely do that. If you're having trouble palpating, have them do the motion, because it just I just have my hand resting there and I can feel it. I'm like, oh yeah, there it is. But your rectus femoris tendon also popped up, and so did your iliopsoas tendon. So that may help you differentiate. If you're like, man, I don't know where I'm at, get your hand in there and have them flex their hip or flex and externally rotate. And hers are blatantly obvious. I mean, I can put my hand like this and I can feel all 3 of her tendons pretty easily right at her hip. Okay. Femoral nerve, L2, L3. Back to rectus femoris, also femoral nerve, but it's L2, L3, L4. Rectus femoris is a hip flexor and a knee extender. Sartorius is a hip flexor, abductor, external rotator, and a small knee flexor.
Do we have to know the knee flex part 2?
Uh-huh. Because it's a 2-joint muscle. Okay, so as far as actions and concentric, eccentric, I do all of them sitting. Let me sit up. Hip flexion, iliopsoas wise and rectus femoris wise, I think your lab handout says have them sit 90-90 and then just have them flex their hip. Okay, that's all and good, but how do I differentiate which one's rectus femoris and which one's iliopsoas? How might I do that?
Is iliopsoas more inner, more inside?
Flex knee.
It is. Well, if I just have her flex her knee, though, it's going to be both. So how can I bias one versus the other? I can't completely isolate one or the other because they're both hip flexors.
Extend the knee.
Cross-sternal rotation.
Okay.
That's the sartorius, is this one.
Yeah, that's sartorius. So sartorius kind of stands alone because it has the combined motion. So we'll come back to that in a minute.
Is the biceps a knee flex?
Think active insufficiency. Is the iliopsoas a 1 or 2 joint muscle?
It's 2 joints.
2.
If you count the spine, it's technically 2. But as far as the hip goes, it's only 1.
Okay.
What about the rectus femoris? Definitely 2, right?
So
Crosses the hip and crosses the knee. So if I extend my knee and then have her lift her hip, that's really hard.
Yeah, that really hurts.
And that's creating some passive squishy for your hamstring. So you could do it that way, probably not the best way. How else could you do it? I think the other end. So if I could shorten it from that end, what could I do? Or could I make the rectus femoris passively insufficient to make the iliopsoas a little bit more prominent?
Bend forward. No.
If I bend forward, okay, so let's talk about if she's just sitting neutral. The position of the iliopsoas is pretty much its normal resting position. The position of the rectus femoris right now is long here, short here. If I want to make it passively insufficient, what could I do?
Long.
Okay. So this one's already, there
So
you
lay
go.
down.
Put your hands back. Do that.
And then do.
No, don't extend it. Now just lift your hip.
Oh, okay.
Versus coming up, now lift your hip.
No, okay. I'm using more both of them than.
Right. So again, you're not going to completely exclusively isolate one or the other. They're both hip flexors. But you can pretty much make the rectus femoris passively insufficient. Just lengthen it, and you're getting more iliopsoas and less rectus femoris just because it's too long. It's not going to be very efficient. So if you have them lean back and lift, that's more iliopsoas. If you have them set up and lift, more rectus femoris. But again, not in complete isolation. Both are still working. It's just you can bias one a little bit better than the other one. Okay, so concentrically, if I'm doing iliopsoas, concentric is up, eccentric is hold up, Y push down. Okay, rectus femoris, setting normal, lift up concentrically, push down. Well, you keep pushing up as I push down eccentrically. These are strong muscles, so watch your body mechanics. I probably wouldn't be sitting. I just do it so you guys could see. But for most of you, you're probably standing to do this, just from a muscle force production for you and your hands. Be careful your patients don't cheat. Now, if you have them laying back on their arms, they're already pushing. But if she does this and she's weak, she'll tend to try to push up with her arms. So watch for some compensatory motions. Sometimes I'll have people do this just so they don't cheat. So these are ones that you can see some compensatory motions. So
Can you do knee extension for rectus femoris?
absolutely. So rectus femoris can also, so like in a comp, if you get rectus femoris, it should say at the hip or at the knee.
Okay.
So you'll know whether to test it as, I mean, you still got to say all of its functions, but you'll know whether to test it as a hip flexor or as a knee extender.
Okay.
Okay?
If it's a hip.
So if it's a knee extender, you'll do it with the rest of the quads, which we'll get to here when we get to knee.
Okay.
Okay? So that's iliopsoas, rectus femoris. Sartorius, the hard thing about sartorius is getting your hands in the right place to resist all three motions. So the concentric is easy. I want you to take your foot and cross it over your other knee. So that's flexion, abduction, external rotation, right? Everybody good? Okay, so now I have to be able to resist all three of those motions. So I have to be able to push into adduction, extension, and internal rotation. So this is one where I need both hands to create the resistance. I can't stabilize with one hand. Versus if I'm doing straight hip flexion, I might stabilize here, I might stabilize here. I'm going to use my other hand to stabilize and just resist here. For sartorius, I need both of my hands to create the resistance because you have to resist three motions. So she's flexing, abducting here, and externally rotating here. I mean, it's all happening at the hip, but that's pretty much the idea. So I'm going to push her in and down with this hand. So into adduction and extension with this hand and internal rotation with this hand. So I'm going like this as she's trying to resist me. Got it? So she's going into flexion. I'm going to push her down to extension. She's going into abduction. I'm going to push her into adduction. And she's going into external rotation. I'm going to push her into internal rotation. Got it?
It'll hurt after a while, not using your hands.
Yeah. It's not an endurance muscle by any means. Okay? So concentrically, you just have them take their foot and cross it over the opposite knee. Now I'm going to try to hold it up there as I push it down. Ready? Good. Now be careful that you don't over torque this hand and hurt somebody's knee. That creates a lot of valgus stress on the knee, so just be careful. Okay?